Where is a hysteroscopy procedure typically performed? Have you ever wondered where a hysteroscopy is typically performed? This procedure is a minimally invasive way to look inside the uterus using a thin, lighted instrument called a hysteroscope. It is commonly done in main settings, outpatient clinics and hospitals. The choice of location often depends on the specific needs of the patient and the complexity of the procedure. In many cases, hysteroscopy can be performed in a doctor's office or an outpatient clinic. This is especially true for simpler procedures. In these settings, the patient may not need general anesthesia. Instead, local anesthesia or mild sedation is used, making it quick and convenient. This approach is often chosen for diagnostic purposes or minor treatments related to fertility or conditions like endometriosis. On the other hand, for more complex situations, such as when surgical removal of fibroids, polyps, or extensive adhesions is necessary, hysteroscopy is typically performed in a hospital operating room. In this setting, patients usually receive general or regional anesthesia to ensure comfort during the procedure. This is especially important when the procedure is expected to be more invasive. Hysteroscopy plays a vital role in diagnosing and treating uterine abnormalities that can impact fertility. For example, it helps identify issues like fibroids, polyps, or intrauterine adhesions. Additionally, it allows doctors to assess the uterine cavity for any lesions or scarring caused by endometriosis or other conditions. When performed in an office setting, hysteroscopy allows for timely evaluations without requiring hospital admission. However, some patients might benefit more from the hospital setting if their situation requires extensive intervention. In summary, a hysteroscopy is typically performed in either an outpatient office or clinic for diagnostic purposes, or in a hospital operating room when surgical treatment is needed. The decision on where to perform the procedure depends on factors like the complexity of the case, the comfort of the patient, and clinical indications related to fertility or endometriosis management. Always consult with a healthcare professional for personalized advice regarding this procedure.